That was one correlative program to this concept trial, and there we looked at which cardiovascular adverse events occurred, when did they occur, and how, as biomarkers, proBNP and troponin I could play a role in prediction or not. And I think one of the key, or maybe let me share 2 or 3 key findings. Overall, cardiovascular adverse events, if you at least use a broad definition, are common but do not lead to treatment discontinuation. They can be managed. They are more common in patients with cardiovascular comorbidities to start with, and in obese patients, obesity as a known cardiovascular risk factor. So there you would probably be a little more careful. And then NT-proBNP is actually very frequently elevated at baseline in this patient population, which was a factor that was not known so far, but it is not associated with the occurrence of cardiovascular adverse events. Bottom line, do not withhold carfilzomib-based effective treatment option for your patients just solely based on proBNP. We did see, however, a significant correlation for troponin I, but indicating that troponin I levels below a certain threshold, 2.9 nanograms per liter, are actually associated with a significantly less probability of cardiovascular adverse events, and or with a rise in troponin I within the first 3 induction cycles, treatment cycles. This could show a higher risk. So there's still more research to be done, but there's just a few snippets of the presentation. I think it's important because we do know that carfilzomib does have a higher rate of cardiovascular adverse events, but it is a very high and effective, highly effective drug. So we want to give it and be able to deliver it safely to many patients, right? And therefore we have to look at also how best to manage. And there have been great papers also by colleagues and guidelines by the EMN, Sarah Bringen and others, which have really shown that, or also given guideline on how to manage these patients. And it's key to have a thorough baseline assessment and then also reassess your patients under treatment. So it's not just at baseline, but also look at how they're doing under treatment. So optimally in cooperation with cardio-oncologists, which is a growing specialty, luckily, and I was happy to have the possibility to collaborate with our cardio-oncologist and the oncology department at University Medical Center Hamburg-Eppendorf for this analysis.